Okay, picture this. You wake up and suddenly, the very hinges that keep your body moving smoothly are stiff, swollen, and radiating pain. What's actually happening when your body's defense system mistakenly targets its own architecture? That is the exact puzzle we're solving in today's explainer as we decode joint pain. Let's jump straight into the science of polyarthritis. When a patient presents with joint pain, the most critical fork in the road is pinpointing the root cause. Are we looking at a mechanical wear and tear issue? Kind of like the brake pads on a car just slowly wearing down over time? Or are we witnessing a full-blown immune system attack, a literal friendly fire scenario where the body's defenders mistake its own joint tissue for a foreign invader? Decoding these clues correctly, it changes absolutely everything about how we approach the problem. So, to solve this case, our first step as medical detectives is defining our two main suspects. On one hand, we've got inflammatory causes, like rheumatoid arthritis, which are driven by systemic inflammation. And on the other, mechanical causes, like osteoarthritis, driven by that wear and tear we just mentioned. Now, both cause pain and stiffness, sure, but their underlying mechanisms are entirely different. The patient's history is essentially packed with these diagnostic clues, especially when it comes to the speed of onset. Mechanical issues or even crystal-induced ones like gout can be incredibly sudden. Like, a patient might wake up in agonizing pain out of absolutely nowhere. But inflammatory issues like rheumatoid arthritis, they're insidious. They creep up slowly, day by day, until that stiffness becomes just impossible to ignore. Right, so a really crucial point here is symmetry and location. Think about it. The immune system is systemic, meaning it travels everywhere through the blood. Because of that, an inflammatory attack like RA typically mirrors itself. If the right wrist and middle knuckles, those MCP and PIP joints, are swollen, the left side usually is too. Mechanical wear and tear, however, is deeply tied to how we physically use our bodies. Osteoarthritis targets specific, often asymmetrical areas that bear weight or take repetitive stress. Think hips, knees, or the very tips of the fingers, the DIP joints.
And this brings us to a brilliant interrogation tool in our clinical toolkit, the morning stiffness test. When a patient sleeps, inflammatory fluids pool in their joints. If they wake up and feel intensely stiff for over an hour, well, that prolonged duration heavily points to an inflammatory culprit like RA. Their joints literally need to be warmed up through movement to physically push that inflammatory fluid out. Mechanical stiffness, on the other hand, like in osteoarthritis, typically resolves much faster, usually in under 15 minutes once the person just gets moving.
To really build our case, though, we have to zoom out from the joints and look at the scene of the crime across the entire body. Because inflammatory arthritis is a systemic disease, the immune system is on high alert everywhere. We're looking for high-yield clues here: oral ulcers, maybe some unusual scaly skin lesions, or painfully red eyes. Finding any of these immediately shifts our diagnosis far away from simple mechanical wear and tear. Spotting specific physical exam findings, like that classic malar butterfly rash across the cheeks and nose, or eye changes like episcleritis, immediately tips us off. It's proof that the immune system isn't just attacking cartilage. It's wreaking systemic havoc on connective tissues throughout the whole body. Honestly, these physical exam findings are absolutely vital red flags. Once we've got our clinical suspicions, we finalize the investigation by running the forensics. Basically, we draw blood to look for autoantibodies. These are the chemical signatures of an immune system gone completely rogue. We look for rheumatoid factor, or RF, and anti-nuclear antibodies, ANA. But the real star of the show for rheumatoid arthritis is anti-CCP. Finding these in the blood, that acts as undeniable microscopic proof that an autoimmune attack is actively taking place. Anti-CCP really emerges as an early and aggressive marker for rheumatoid arthritis. What makes it so incredibly powerful is its high specificity. We're talking around 90%. If this antibody is present, it practically locks in our diagnosis, even in the very early stages. It is the exact smoking gun we need to initiate aggressive treatment. Finally, we look at the structural damage left behind using X-rays, and wow, the contrast is stark. On the mechanical side, as the cartilage wears away, you get focal joint space narrowing, and the bone tries to stabilize itself by building new, jagged bone spurs called osteophytes. But on the inflammatory side, the immune system just causes destruction. We see generalized narrowing, highly destructive bone erosions, and periarticular osteopenia, which is basically a localized decalcification of the bone right near the inflamed joint. To put osteoarthritis into perspective, it is fundamentally a degenerative disorder with very minimal articular inflammation. The hallmark structural changes you'll see on an X-ray include that focal loss of joint space and an increase in subchondral bone density, which is technically known as sclerosis. Because the bone underneath the worn-away cartilage is taking the brunt of the physical load, it actually thickens and hardens in a mechanical response to that stress. So what does this all mean for us? Decoding these clues early, from morning stiffness to specific autoantibodies to X-ray patterns, isn't just some academic exercise. Distinguishing a mechanical breakdown from an inflammatory siege is the absolute key to stopping irreversible joint destruction. Getting this right preserves a person's mobility, their independence, and basically their life as they know it. The clues are all there, just hidden in plain sight. So the next time you or a loved one feels a persistent ache in your joints, you really have to ask yourself, is this just normal wear and tear, or is your immune system trying to tell you a much more dangerous story?